Hello everyone, this is Mamata Rani Chennupalli. Welcome to our Pmch Public Health Awareness video. So our topic is about how mental illness leads to suicide and how to prevent it. So let's start the video.
Hi, this is Vijay Kumar. I have a question about mental health. Can you explain what mental health is?
Hi Vijay. Mental health includes our emotional, psychological and social well-being. It affects how we think, feel and act. It also helps us to deal with stress and make healthy choices. Mental health is very important at every stage of our life, from childhood and adolescence through adulthood.
Hello, I'm Sheetal Kindikeri, and my question is, can mental health change over time?
Yes, Sheetal, mental health can change over time depending on many factors. When situations go beyond their abilities, their mental health can be impacted. For example, if someone is working for hours, facing financial stresses, etc.
Hi, this is Haripriyanka. I have a question about mental health. How common are mental illness?
Haripriyanka, mental illnesses are the most common health conditions in the world. More than 50% will be diagnosed with mental illness or mental disorder at some point in their lifetime. There is no single cause for mental illness. A number of factors can lead to mental disorders.
Hello, my name is Milan Bojani. My question is what are the type of mental disorder?
Milan, we can see some types of mental disorders like anxiety, depression, bipolar disorder, phobias, schizophrenia, eating disorders, personality disorders, PTSD, etc.
So this is Badam Reshma. I have a question about mental health. We are seeing more suicides in this world. Is it also due to mental illness?
Reshma, suicide is the second leading cause of death in young people. A major cause of suicide is mental illness, very commonly depression. People feeling suicidal are overwhelmed with painful emotions and sees death as the only way out, losing sight of the fact that suicide is a permanent solution to a temporary state. Most people who try to kill themselves but little later, they are glad that they didn't die. Most people who die by suicide could have been helped. So let me tell you how depression leads to suicide. So we can identify the people who are in depression with some signs. So there are some signs of depression. Anyone who feels down most of the day, nearly weekly or monthly, can be clinically diagnosed as depressed. Depressed individuals may experience loss of pleasure in virtually all activities, feeling fatigue or lack of energy, frequent tearfulness, difficulty with concentration or memory, a change in sleep pattern with either too much sleep or little, an increase or decrease in appetite, with a corresponding change in weight, self-blame or hopelessness about the future. Finally, thoughts of suicide.
Hi, this is Mukesh Chintati. Now I had question about mental health. How to prevent mental illness and suicide?
Yes, Mukesh, we can help a person who is going to be depressed. Us may provide all the support they need in mild cases of depression. Having someone who is willing to listen and ask concerning questions can make a lot of difference. However, even the most caring and involved friends or family members may not be enough in severe cases of depression. In such cases, it is important to seek professional help. Mental health professionals who may be consulted include psychiatrists, clinical psychologists and master level therapists. Some may first seek help from their general physicians or religious counselors. Each type of professional has their own perspective and expertise, and practitioners of all kind have experience dealing with depression. The important thing is seek professional help when symptoms are severe and long-standing. In fact, it is wise to seek help when symptoms are not severe to help prevent depression get worse. And we can prevent suicide also by identifying through some signs. There are some warning signs like being depressed or having other mental disorders, talking directly or indirectly about wanting to die or not to be around, increased social isolation, significant changes in appearance or hygiene, giving away valued possessions, making other preparations for death, a sudden change in mood. While anyone can be suicidal, there are certain risk factors that make suicide more likely. Previous suicide attempts, having a family member, a friend who recently killed themselves, multiple suicides in the community, other recent significant losses such as loss of relationships or job, cultural and religious beliefs supporting suicide, alcohol and drug abuse, feeling of hopelessness, and access to means of suicide like guns and quantity of pills, unwillingness to seek help, barriers to accessing mental health treatment. By identifying these symptoms in someone, we can prevent suicides. A sudden lift in spirits in a depressed person can be a warning sign that they are planning to kill themselves. Any level of suicidal thinking should be taken seriously. And we can try to prevent suicide at home, like listening to them and giving a solution to their problems and helping them to get out of that. When you feel the situations are not in your hand, you should definitely seek professional help. There are some hotlines to help the persons who are thinking about suicides and all. If you are feeling depressed, go and consult a psychologist or psychiatrist. This is not a wrong thing. Make a good decision and go to a doctor, and they will definitely help you. And you have to remember this: death is not correct solution for your problems or for your situation. Depression is like a locked room. You need a key to get out. That key could be your friend or family members or a doctor. Suicide is not the key to get out of the situation. Suicide is not the key to get out of the situation. Thank you.